afternoon, everyone. Today, I am pleased to sign Iowa's MAHA bill into law, further strengthening our commitment to common sense steps to improve health and well-being for Iowans in our state. And I'm honored today to be joined by U.S. Department of Health and Human Services Secretary Robert F. Kennedy Jr. for this very special occasion as he continues his nationwide Take Back Your Health tour. Secretary Kennedy inspired the MAHA movement, and he has never wavered in his commitment to reform what's broken across food, health, and scientific systems and restore better health for Americans. And as you know, the time for action is now. 60% of American adults and 40% of our children have at least one chronic illness, and Iowa isn't immune to the chronic disease epidemic that's plaguing our nation. More than 37% of adult Iowans are obese, and sadly, so are 17% of our youth aged 16 to 17. Obesity significantly increases the risk of developing and worsening many chronic illnesses. Our diets are unhealthy, our binge drinking rates are among the highest in the nation, and only 26% of adults meet federal physical activity guidelines, ranking Iowa 43rd among all 50 states. Our ongoing cancer research study between the University of Iowa's College of Public Health and the Iowa Department of HHS has found that these types of behavioral risk factors and others, about 70% in the first part of the study, directly correlate with our state's high cancer incident rate. We know that when Iowans' physical and mental health is strong, so is our state, which is why these issues have always been a priority, and we remain committed to supporting good health for all Iowans. Over the past several years, we've established Iowa's first children's mental health system, secured a reliable behavioral health funding source, and realigned 32 disconnected mental health and substance use service areas into 7 unified behavioral health districts. Iowa was also the first state in the nation to submit a waiver for Healthy SNAP, refocusing federal food assistance programs on the actual purpose for which they were created, helping low-income families afford nutritious food. Today, with the approval of the USDA, Iowa's SNAP and summer EBT programs will support the purchase of produce, grains, meat, and dairy, but candy and soft drinks are no longer covered. Our MAHA bill directs Iowa HHS to request federal waivers each year to maintain these changes, stopping government from enabling unhealthy behaviors that lead to chronic illness and marks the beginning of a new day of accountability and health. It also requires that physicians in Iowa take evidence-based nutrition classes in medical school and as part of their continuing education so that they can support better patient education, engagement, and healthier outcomes. This perfectly complements what our state is doing through the Rural Health Transformation Program. Using the $209 million we have been awarded for year 1 of the 5-year federal initiative to better integrate primary care and chronic disease management. The bill also improves the well-being of our kids, removing many dyes from school lunches, increasing physical activity requirements, and ensuring that screen time is limited for young children. And what better way to celebrate National Physical Fitness and Sports Month than to bring back the presidential fitness test, which President Trump and Secretary Kennedy have done so much great work to revive at the federal level. Finally, for Iowans struggling with behavioral health issues, this legislation further expands access to care by allowing psychologists licensed in other states to practice in Iowa. Altogether, this bill advances the health and wellness for every Iowan today and for generations to come. And as governor, I couldn't be prouder to sign it into law. But these improvements shouldn't be limited to one state. And that's why I appreciate that Secretary Kennedy and his team are driving a national conversation and supporting similar reforms in states across the country, taking on tough issues that has been ignored for decades. Secretary, I would like to invite you to say a few words about the significance of this movement.
Thank you very much, Governor Reynolds, and thank you everybody for being here, and to the press. My job is one of the best jobs that I could ever imagine happening, and one of the reasons for me for people in the world. And we spent zero on chronic disease when my uncle was president. Today, we spend $4.3 trillion on chronic disease. 48 cents out of every dollar that Americans spend in taxes is going to healthcare. 90% of that is going to chronic disease. Most of these diseases we just didn't have around in the 1960s. And there are all these perverse incentives that are driving a decline in our healthcare system, so that we have the most expensive. We spend 2 to 3 times what Europeans spend for public health per capita, and we have the worst health outcomes in the world. We're literally the sickest population in the world by the metric of chronic disease. And my agency is confirmed because it's a target-rich environment. There's things that we can do every day that will have genuine effects on our but one of the great pleasures for me of running this agency has been meeting with all the governors. They're trying to do great things in their states, and there's none that has given me more pleasure than Kim Reynolds, because she's really transformed this state into a laboratory of innovation to address real problems that real people are having. And I just came from a great round table with these extraordinary, very, very high caliber people from the University of Iowa Medical School to the CEO of Hy-Vee, and innovators and leaders and politicians who are taking the policies that we're trying to push and the money from the Rural Health Transformation Program, and then spending it in these extraordinary ways in this state. And it's I'm very grateful to you for your leadership, your vision, your courage, and your innovative orientation. And I want to thank the members of the Iowa State Legislature for leading the effort to make Iowa healthy again. Iowa is an essential partner in the national movement to make America healthy again. As HHS advances reforms at the federal level, Iowa is leading by improving nutrition, strengthening public health, and building a stronger future for American children and families. Governor Reynolds signed legislation today that directly addresses the root causes of chronic disease. The bill strengthens nutrition and metabolic health education for physicians and medical students. It improves school meals by removing harmful dyes and other additives. It increases physical activity for students, and it restores the presidential fitness test and limits excessive classroom screen time for children. The bill also requires Iowa to continue pursuing federal waivers that support healthier food choices through SNAP. Iowa has already led the nation by removing soda and candy from SNAP, and we issued one of the first SNAP waivers in the country to Iowa. Thanks again to your leadership and your alacrity. The University of Iowa has already signed our nutrition education pledge, and will require at least 40 hours of nutrition education or an equivalent competency standard for medical students beginning in 2026. Iowa is showing the country what bold public health leadership looks like by focusing on prevention, nutrition, physical fitness, and healthier lifestyles for the next generation. And we know why this matters. America is facing an existential crisis, as I mentioned. We spend more on healthcare than any nation in the world, and yet for this is nearly 90% of healthcare spending goes to treat chronic disease, and more than 40% of every federal dollar goes to treat diet-related conditions. More than 70% of adults are overweight or obese. 1/3 of U.S. teens have diabetes or prediabetes. When I was a 10-year-old boy, and my uncle was president, the average pediatrician would see a single case of type 2 diabetes over a 40 or 50-year career. Today, 38% of teens are diabetic or pre-diabetic, and that should get everybody's attention. 1/3. The chronic disease crisis is also a national security crisis. 77% of our children cannot qualify for military service, largely because of obesity or chronic disease. Decades of failed policy and perverse incentives transform one of the world's greatest healthcare systems into a sick care system that profits from illness instead of protecting health. But under President Trump's leadership, HHS has delivered the most sweeping public health reforms in modern history in just 15 short months. We released updated dietary guidelines with one clear message: eat real food. These are science-based guidelines instead of politicized science as they were for the past 40 years. We removed petroleum-based dyes from our food supply. We are revising the GRAS standards to ensure that FDA, for the first time, knows what chemicals are in our food. When I came in, I asked FDA, how many chemicals are in our food? And they said, well, we don't know. We don't have a list of them. It's somewhere between 4,000 and 12,000. And that's because the industry hijacked the GRAS standard and added all these chemicals. In Europe, they only have 400 chemicals in their food. And the 9,600 actual ones that we have are all illegal there. We are partnering with governors across the country to remove soda and candy from SNAPs, and 22 states have already gotten waivers. Through the MFN, the most favored nation pricing, and Trump RX, we're lowering prescription drug costs after Americans spent years paying many more times than patients in Europe for the exact same medicines made in the same factories with the same packaging. Just this week, President Trump added more than 600 generic medications to Trump RX. We encourage more than 50 medical schools to incorporate the 40-hour nutrition education curricula, with many more expected to follow. We've committed $50 billion over the next 5 years to the Rural Health Transformation Fund, a transformational investment that strengthens rural healthcare systems and expands innovation, improves access to care in rural communities. And today I got a showcase of how this state is using those funds. This state has done better than any other state at getting the money out the door and to programs that really count, and has an incredibly strong auditing program so that we make sure that every dollar that goes out there is improving public health. We're cracking down on fraud, waste, and abuse that distorted public health for too long. And we're requiring insurers to disclose prices and coverage clearly and publicly so Americans can finally see the true cost of their health care. And through President Trump's Great American Health Care Plan, we're also putting patients back in control of their health care decisions. That plan gives Americans direct control of their health care dollars and increases price transparency and forces the healthcare marketplace to compete for patients instead of trapping them in opaque systems. And patients control their own healthcare decisions, markets become more competitive, doctors reclaim independence, patients regain dignity, and costs come down. Only 50%, when I came into office, only 50% of hospitals published their price list. Today we've got it up to 80%. By the end of the year, we're gonna have 100% because we're about to do some major enforcement actions over those that don't comply. And if you go to a restaurant and you order food, you can see from the menu what the price is. If you go to a car dealer and he said to you, you buy the car and then I'll tell you the price, you would think he was crazy. That's what hospitals do all over this country right now, and we're ending that. The Great American Health Care Plan moves our country away from a sick care model. We're a true healthcare system centered on prevention and long-term health. This is exactly why Iowa's leadership matters. Real public health reforms require federal action and state leadership working together to improve nutrition, put prevention at the center of healthcare, and give the next generation a prosperous future. I want to thank again Governor Reynolds for her leadership and vision, and I want to thank the Iowa legislature whose hard work, bipartisanship, and commitment made this MAHA legislation possible. Thank you.
challenge us to be better each and every day, and we're gonna continue to do that. I also want to take a moment to thank the floor manager, Senator Warmy and Representative Harris, for their strong commitment to this bill, and I'd also like to give them the opportunity to say a few words.
Thank you. Well, welcome to Iowa, Secretary Kennedy. As a former 4-H kid, you should feel right at home here. And thank you for your passion to make America healthy again. We are proud in Iowa to be leading the way on these policies led by our Governor, Kim Reynolds, who made this a priority at her condition of the state address in January. The Iowa MAHA bill refocuses the state's efforts to improve nutrition and physical activity for all Iowans, but with an especial emphasis on our children. You've heard the statistics of chronic health problems across our country, with more than 40% of children with one or more chronic illnesses and obesity as a main driver. In Iowa, 1 in 6 children is considered obese. Good habits start early, and so we need education and to hold our systems accountable, and that's what this bill does. As a mother of 2 teenagers, my favorite division of the Iowa MAHA bill deals with screen time for kids. That has negative impacts on learning outcomes, physical activity, and brain health. We started last year in Iowa getting cell phones out of classrooms. Now, for students in kindergarten through 5th grade, digital instruction on one-on-one devices will be limited to 60 minutes a day, with some common sense exceptions. We also require a study of technology use in grades 6 through 12. This is something we hear about from parents and teachers often. Technology is a great tool, but it needs to be a supplement to learning and not replace the fundamentals. We also want to get our learners moving again, and we hope that in this bill with increased minutes of daily physical activity and with the presidential fitness test. Secretary Kennedy has said we need to put our differences aside for the sake of the health of America. That's what the Iowa MAHA bill is all about. I was honored to manage it through the Senate, and we are thrilled for Governor Reynolds to sign the bill today.
Thank you all. Thank you, Mr. Secretary, for being here. And thank you, Governor, as well, for having us. I'm excited to be here today for Iowa to sign into law the largest MAHA initiative that any state in the nation has ever taken. You know, Governor, when you introduced the bill, I think there was about 5 or 6 divisions, and we have a bit of a tendency in the House to add some things. So, as our Senate colleagues know well. But Senator Warmy and Governor Reynolds and Secretary Kennedy touched on it. This is really a common sense piece of legislation. When you list the stats of Iowa's health records, it would be a dereliction of duty to do nothing, and that's exactly what we're doing today. Whether that's making sure that we have healthy foods for SNAP, whether they're doing the presidential fitness test, Iowa's now going to be leading the nation for physical activity in our schools, and there's so much more to this bill, as I mentioned, that we added to it, but I'm very excited about what we're doing today, and I think it's historic.
Representative Harris, for being such strong champions, and you do add a lot, both of you do. It was a great bill. I think, you know, we all played a role in it. We came out with a great bill, so thank you. I'm excited by the progress that MAHA is making across the country, and incredibly grateful for the overwhelming support that it has received here in Iowa, and with that, I am excited to sign it into law. it does. So when I sign, so I think it's actually called the rise, right? Okay, there's that, there's no sense of that, but you're gonna some markers?
Rachel? Okay, you ready for that group photo? Yep. Everybody look here for a group photo. Rachel?
Fusion. Got it? All right. Everyone, 1, 2, 3.
That's it? Got it? Okay. Thank you, everybody. Thank you.
Thank you.